Treating breast cancer can be a long process, and it can be emotionally and physically trying. Magee offers many support services to help patients through this difficult time. Some patients feel comfortable talking to a counselor individually, while others prefer a support group setting. Breast cancer survivors who have first-hand experience volunteer their time to offer advice and support.
I'm sure husbands, look at you and you don't look as good as you used to, but you'll come out of it, and if they hold you and snuggle with you and make sure you know that you're going to be strong through this and everything will be okay, then it's all right.
I felt I had to be strong for my children, and I denied times when I really didn't feel 100%, and that's not fair to the caregivers because they're truly wanting to do something for you, and be honest with them and say, today I don't feel 100%. Sure, bring dinner over or something to that effect. I think that's very important, not to deny your support system when they want to help you. And you don't have to be a hero going through this. There's times that you can ask for help and receive it gracefully.
When they are diagnosed, many patients ask how much time to allow for surgery, follow-up, and recovery. Consider the day of diagnosis as day 1. Patients generally see a surgeon in 7 days or so. Prior to the operation, patients have tests to look for evidence of the spread of cancer. Typically, surgery is scheduled within 6 weeks from the time of diagnosis. Patients are encouraged to get a second surgical opinion if it will make them more comfortable. Physicians understand that this is an important decision and will not be offended. Some patients require preoperative testing because of other health problems. Others may want to see a plastic surgeon to consider reconstructive surgery. Minor delays should not change the outcome of the operation. After surgery, pathology reports are generally available in 4 to 5 days. In some cases, where a more extensive amount of tissue is taken, it may take longer. Magee surgeons or associates call individual patients to review the results of their pathology report. After the pathology review, a medical oncology consultation is scheduled for the patient. If chemotherapy is a part of the treatment program, it generally begins 3 or 4 weeks after the operation and lasts for 3 to 6 months. If radiation therapy is needed, it is scheduled after chemotherapy. Otherwise, radiation therapy begins 3 or 4 weeks after surgery. Hormonal therapy for patients who are estrogen receptor positive is the final treatment in the sequence. It starts when chemotherapy and radiation are complete and lasts for 5 years or more. Each therapy adds to the effectiveness of the treatment of breast cancer. However, breast cancer survivors are at higher risk of getting cancer again. In the years to come, healthcare professionals will want to review annual mammograms and follow up with clinical breast examinations. Diligent and attentive care is essential to remain well.
I feel absolutely wonderful. I feel great.
I feel great now. I really do. I'm active again. I should say this, it takes a few years to recover from it. Don't think that right after you have your chemo, all of a sudden you're going to be better in a day. Your body has a lot of healing to do, so you have to be patient with yourself.
I just wanted to pack a lot in because I wasn't planning on getting cancer, and when I did, it was a big surprise. And so I thought, wow, I don't know if I'm going to get sick again, so I better hurry up and get a lot done. And that's exhausting to pack in every fun thing you want to do in your life. But there comes a time where you start to relax and say, it's okay. But I feel well.
I feel great. I really do. I feel great.
Believe me, I enjoy life far more than I ever thought I could, and I do stop and smell the roses. I enjoy my grandchildren, and I wake up each day and I'm really glad that I just try to live at the fullest. I enjoy every day of life.